Who can forget the headlines? Risperdal, a popular mood disorder medication, has been linked with gynecomastia in young boys. Gynecomastia is the growth of breast tissue. It terrifies us as parents what these pharmaceuticals can be doing to our children. There are complementary and alternative therapies that can help with ADHD in children. We're all parents. ADHD is widely diagnosed. I have extensive research with ADHD and its treatments, plus Sean has ADHD. The main points that I want to preview in this are dietary modifications, herbal and organic supplements, and various therapies. And that's just a sample. There's so many more that I'm not going to have time to cover in this. Our first one that we're speaking about is dietary modifications. Not just taking out of your child's diet, but putting into your child's diet. Talking about taking out gluten, sugar, artificial colors, artificial preservatives, and artificial flavors. And I'm talking about adding in probiotics, minerals, vitamins, and protein with every meal. Raise your hand if you feel like you don't have time for that. Janice Fellow, a homeopathic technician, states that probiotic therapy may be useful in reducing hyperactivity symptoms in ADHD. Carbs equal sugar. Sugar equals irritability, restlessness, and increasing other symptoms that mimic ADHD, even in children that don't have it. Food coloring does the exact same thing. The Feingold diet removes all artificial colorings, preservatives, artificial sweeteners, and it's the most popular and effective diet for children with ADHD. They're picky kids. It's hard to get them to eat what you want them to eat, right? They're fun and simple things to add into your child's diet. They need vitamins, minerals, supplements. These deficiencies are linked with ADHD. Protein is needed in your child's diet to break down slower in their digestive system and release stored energy in small bursts instead of one great big burst that's carbs and sugars do. It's essential to have protein for the amino acids that are needed in your body. There's protein shakes, peanut butter, beans, a whole list of protein things that can be added into your child's diet to get the needed protein in that are simple and don't take all your time. There's also herbal supplements. There's a variety of supplements that have been known to alleviate symptoms and reduce the need for medications. Omega-3 fatty acids, melatonin, St. John's wort, and chamomile, just to name a few. 25% of kids with ADHD also have anxiety. Rodilla, which is used for anxiety to depression, increases mental performance in ADHD. It's huge. No side effects, no gynecomastia, none of that. There's more research needed, but obviously it's unethical with children. That should not deter you from giving your child a supplement in small doses to see how it will work. I'll be seeking this out myself for my anxiety. Any treatment program will never be complete without some type of therapy. They can learn to train and control muscle impulses with cognitive behavioral therapy. Children have to learn so much information growing up, and an ability to control themselves is huge. It's paramount in being an adult and being able to control your impulses as an adult. If we medicate that away, or we ignore that symptom, they're not going to learn how to function as an adult. Talk therapy does so much for anyone. Children cannot be left out of that loop. They need the talk therapy to have an outlet. They need occupational therapy, which gives them a physical focus. Physical helps children across the board. Be your child's advocate. Do your research. Don't settle for one solution when there may be a better answer. My main points were dietary modifications, herbal and organic supplements, and behavioral therapies. Do your research. Be your child's advocate. They can't do it themselves. They need you.